Hi, I'm Aislinn Antrim from Pharmacy Times. Before we get started today, one of our top stories right now is about how a specific brain circuit may be responsible for a decline in learning as people age. So there's more about that on Pharmacy Times. Today I'm speaking with Susan DiGregorio, Director of Clinical Pharmacy Development at Community Care RX, about the recent HHS authorization of pharmacists to administer childhood vaccines. So Susan, we've seen a major push for pharmacists to administer childhood vaccinations, especially during the COVID-19 pandemic. In August, of course, HHS allowed licensed pharmacists to administer these vaccines, but some pediatricians have voiced concerns about this. Can you discuss what their concerns are?
Sure. So some of the concerns of the American Academy of Pediatrics discussed how they feel that utilizing pharmacists is going to deprive the children of Medicare and clinical guidance. They also feel that a child might miss a vaccine and that they wouldn't see their pediatrician who is the person that they know and that they trust. And that they also feel that many diseases are going to go undetected.
Okay. What are they asking for? Do they want this just undone, essentially?
Basically, yes, they want to have the whole AHHS decision rescinded, and basically for the reasons that I stated up to that.
Okay. What is your response to that? What is the value of pharmacists in administering these vaccinations?
So basically, HHS feels that allowing pharmacists to administer vaccines is going to give the patients more options to be able to protect themselves and their well-being. They also feel that, we feel as the pharmacists that the value of pharmacists administering the vaccines opens up way more options for the patients. Children still have to go to the pediatrician yearly. They're going to go for their yearly visits anyway. So as far as them missing any kind of clinical or medical support, they're still going to get that. And of course, they go to the doctor when they're sick as well. And we now have state registries, and the state registries help keep everybody up to date and keep everybody informed with what's going on. As far as when they say that knowing and trusting their pediatrician, well, we hope that they know and trust their pediatricians, but pharmacists are one of the most trusted professions. And so they can get to know and trust their pharmacists as well. And the pharmacist is an extra resource for not only vaccines, but for medication and clinical guidance. Patients see their pharmacist way more than they see their doctor. And so to have that ability to not only get a vaccine, but the ability to ask questions and take time and discuss any medical issues, they're always there for them as well. And in my opinion, the whole healthcare system is overwhelmed, so why not utilize the pharmacist? And if pediatrician, I've taken my children to the pediatrician, and what happens? I have to wait and wait and wait and wait, and it's frustrating for not only for us but the kids as well. And utilizing the pharmacist is going to free up physician appointments. Is going to allow for the doctors even to maybe make more appointments. So I think it's going to make the system quicker, more efficient, and that's kind of what I feel about that.
Wonderful. Collaboration between these medical professionals is of course important, and especially during the pandemic. How should pharmacists be working with pediatricians as they administer these vaccinations?
So collaboration is the present of future. It's the present of medicine, and it's definitely the future of medicine. And it is the absolute best care for patients because it is a rounded approach, and you have all teams and all disciplinaries working together. So pharmacists working to improve. So basically, that's what I would say is that it's something that is very important for the patient and helpful.
Absolutely. How can pharmacists improve on this collaboration if that's a concern that pediatricians have?
So you can remind the physicians that it definitely has been shown to give improved outcomes. It is shown to enhance patient satisfaction, and the care is more efficient. It's more patient focused, and it's more cost effective for the patient and for the professional.
Wonderful. In addition to pediatricians' concerns, anti-vaccine advocates or protesters have also expressed their concerns. What are their concerns about allowing pharmacists to administer these?
So I wouldn't necessarily that it's just a matter of allowing pharmacists. People who are anti-vaccinated, anti-vaxxers are anti-vaxxers, no matter whether you're talking about going to the pediatrician's office or you're talking about having the pharmacist administer them. And I would just basically remind them that since the first smallpox vaccine has come out, there's always been public concern regarding adverse events. Parents worry about giving their child too many vaccines and that they might weaken their immune system, which is not true. And a lot of times there's mixed and inaccurate information out there in the public, and it tends to cause panic and then not wanting to give their kids or have their kids vaccinated. I always talk about the telephone game and how it's like you hear something that maybe was negative and then you tell someone else, but you added on another word and it goes and goes and goes. And that really is spreading how false information gets spread. And just because one person has experienced a negative reaction, it doesn't mean that everyone will, or it doesn't even necessarily mean that person experienced it from the vaccine. It could have been a coincidental situation, like I would say something like autism. People are concerned that the vaccines cause autism. However, that study was actually rescinded, and they kind of, I would just remind people who are concerned about that unfortunately, autism tends to develop at the same time period that the children are getting the vaccine. So that's what I would say to that.
Absolutely. How can pharmacists respond to people who are anti-vaccine, especially when it comes to their children?
I would tell them the number one thing is that a person is more likely to have a life-threatening, serious adverse reaction, possibly death, from a vaccine-preventable disease than from the vaccine itself. And I would remind them that diseases have not disappeared; they're still there. And we've been working very, very hard over the years to help eliminate diseases, but by all means, are they not gone? And to talk to your pharmacist, talk to the doctor, talk to educated people, get educated, and confirm what you hear. Don't always assume that everything that you hear is correct. Don't just listen to anyone off of the top.
Wonderful advice. Finally, what is the overall value of pharmacists in vaccine administration for kids, for adults, for anybody?
Well, the overall value would be the accessibility and the convenience. Like I said earlier, we're there. We're probably seen more than their doctor. We don't want to take away from them going to the doctors, because we know that's important as well. And they go there anyway because they need to get their annual physicals for school. But the pharmacist is accessible, is convenient. We have studied 6 years plus, doctoral program plus residency. So we're extremely knowledgeable. We already are working collaboratively, and we, like I said, you visit the pharmacy more than the doctor's office, and because of that, we've been improving vaccination rates, which have been falling. So working with the pharmacist would definitely help keep those vaccination rates up.
Absolutely. Well, thank you so much for joining me. Now we're going to hear from some of our other MJH Life Sciences brands on their latest headlines.
Thank you so much, Aislinn.